Okay, now let's talk about the diagnosis. Okay, diagnosis of Parkinson's disease. Now here there is no any specific diagnosis, but two things play a very great role in the diagnosis of this Parkinson disease. Okay, the one is called as physical examination and neurological examination. Physical examination. Another one is called neurological examination. These examinations, okay, this is the main examination, okay, in order to diagnose the Parkinson's disease patient. Because we seen that patient show some, you can say, some gross symptoms like the tremor, rigidity, or bradykinesis. Remember, tremors, rigidity, and bradykinesis. This is the hallmark of Parkinson's disease. This is the hallmark of Parkinson's disease. Okay, and sometimes there is in the later stage of this Parkinson's disease, there is a posture abnormality. There is a posture abnormality. Fine. Then apart from it, so for these symptoms, we can diagnose through the physical examination, okay? And through the neurological examination or assessment, neurological examinations, we will, you can say, study the neurological function. Basically, we will measure the cognitive function, okay? Cognitive function. So we have the mental examination. We will test the motor skills like the writing skills, okay, typing skills. These all are the neurological examination, okay, the reflexes. Fine. Then we have certain, you can say, imaging techniques. So imaging techniques, we are generally using the CT scan and PET, called as the positron emission tomography. Okay, by this we are basically putting the radioactive, you can say, dyes or tracer, okay, and thereby we have the, you can say, picture about the specific area, abnormal specific area in the brain. Okay, then there are one, you can say, the test, okay, and that is called as the alpha synuclein. Maybe the pronunciation is incorrect. Alpha synuclein protein test, because we know that this protein aggregate in the neuron, in the dopaminergic, specifically those dopaminergic substantial niger neurons. So there is a alpha synuclein protein test. So these are the new diagnoses for the Parkinson's disease. Once again, the first one is a physical examination, another one is a neurological examination, okay, then imaging technique and alpha synuclein protein test. Got it? No problem. Now, once we will over with the diagnosis, let's have the discussion about the treatment and management, that how to treat the Parkinson's patient and how to manage. Fine. Now let's discuss about how to manage the Parkinson's disease patients. So we have the different management, which is basically divided into the three types. The first one is called as the pharmacological management. Pharmacological management. Another one is the surgical management. Okay, surgical management, and another one which play a very, you can say, the great role, and that is this term as the non-pharmacological management. Here the nursing management also comes, and there are different therapies. We will discuss one by one. Now coming to the pharmacological management, how you manage the Parkinson's disease pharmacologically. So there are different ways. The first thing which we understood is that in the case of Parkinson's disease, what is happening here is the dopamine and there is the acetylcholine. So due to the degeneration of dopaminergic neuron, okay, the dopamine secretions is less, whereas the acetylcholine, just because there is a compulsion one by another. So just because dopamine is depleted, so this is enhanced. Acetylcholine secretion is enhanced. Fine. So one way to manage this Parkinson's disease is to provide some drug which can enhance the dopamine secretion. Okay, which enhance the dopamine secretion. Now, so that is called as the dopamine precursor or dopamine agonist. Dopamine precursors. Why this is called as dopamine precursors, I will clarify it, or dopamine agonist. Dopamine agonist. And one is to either you can give the certain drug which can enhance dopamine productions, okay, so thereby you have the, you can say the normal movement or these tremors will overcome, fine. Or for the rigidity or posture abnormality or cognition functions, you can provide certain drug which can inhibit the acetylcholine, you can say transmission, and that is called as acetylcholine inhibitors. That is called as the acetylcholine inhibitor. Acetylcholine inhibitors. Okay, no problem. Now, this acetylcholine inhibitor and the dopamine precursors or dopamine agonists is to work just because of this mechanism. Just because of this mechanism. So for dopamine, why is this called as dopamine precursor? Because if you provide the synthetic dopamine, okay, active dopamine directly through, you can say the in the oral form or GIT, it will not cross the blood-brain barrier, because here the problem lies in the central nervous system. So we have to design a drug in such a way that they can cross, they have the less molecular weight or they are liposoluble, okay, then only we can send the drugs to the central nervous system. Otherwise, blood-brain barrier will restrict the transmission of transport of the drug. Okay, so that's why we provide the pro-drug that is called as the dopamine precursor. Okay, and the one drug, the example is levodopa. Okay, levodopa. So for acetylcholine inhibitions, we provide one drug that is called as the procyclidine. Called as the procyclidine. There are one drug that is the antiviral called as the amantadine. Amantadine, which is also working as a dopamine agonist. Okay, so these are certain classes of drug, and this drug are also called as the anti-Parkinsonian drugs. What it is called as the anti-Parkinsonism drugs. Okay, got it? No problem. So this is about the pharmacological management. Okay, and there are, you can say there are other underlying mechanisms. Okay, carboxylic enzyme inhibition done by the carbidopa. Okay, carbidopa, that's one another classes of the drug. Okay, now coming to the surgical management. So for surgical management, there is one technique that is called as the deep brain stimulation. Deep brain stimulation. Write it down. Deep brain stimulation. Now, in the deep brain stimulation, what is happening? Actually, you know that this is central nervous system. Here is the presence of, suppose, motor area, okay, and here there is the presence of substantia nigra, okay, and if here the neurons start degenerating, okay, so if by some means we can stimulate this, you can say the area, okay, electrical, if you provide electrical stimulations, okay, the dopamine secretion will, you can say, not well established, but it will show some effect. Okay, so this is done through the deep brain stimulation. Here we are, you can say, by performing one surgery, we are transplanting the electrode. Okay, electrode here, and that can stimulate this substantia nigra to secrete the dopamine. Okay, that is called as the deep brain stimulation, and currently research is also going on, and also you know that this levodopa, this is in a tablet form first of all, and this levodopa is also not, you can say, not showing all the therapeutic effect, therapeutic effect to the central nervous system, because there is something called as the first pass metabolism. Means anything we put it in any drug we put it in through our oral route, okay. If the drug of administration is through the oral route, then you know that oral route have the one drawback, that it will lessen the bioavailability of the drug, okay, the therapeutic effect of the drug, just because it have to first pass through the first pass metabolism, then it will go into the systemic circulation, okay, and then it crosses the blood-brain barrier. Okay, so there is a less, you can say, availability of this levodopamine precursor. So there is currently there are, you can say, research which basically trying to find out the novel way to deliver this levodopa, so that this drug will show their maximum effect. And the long-term use of the levodopa have some, you can say, the side effect as well, like the extrapyramidal side effect, and you can say certain cognitive abnormalities also. No problem, got it? So this is the pharmacological management, this is the deep brain stimulation is the surgical management. Now coming to the non-pharmacological or non-surgical management. This management goes with providing the therapies, okay, educating the patient, assessment, okay, the diet management, also the assessment of the fall risks, okay, and providing the nursing care. This comes under the non-pharmacological management. So let's conclude today's lecture. Today we discuss about the second or last neurodegenerative disorder, that is called as the Parkinson's disease. It is basically a disease for the motor functions. Here the substantia nigra, which have the dopaminergic neurons which secrete the dopamine, okay, that start degenerating due to the multifactorial reason, multifactorial etiology, okay, and thereby we have the less dopamine, so that person started developing the rigidity, tremors, okay, posture instability. Apart from that, person have the dyskinesia, difficulty to initiate a movement, okay, and the constipations, and also in the later stage they won't maintain the posture and they will fall easily. Then we also discussed about the underlying pathophysiology, that due to the degeneration of dopaminergic neuron, the acetylcholine will, you can say, unduly pathologically it start, you can say, over functional secretion of the acetylcholine, and whereas the dopaminergic neurons will lessen. That's the underlying mechanism. And we also discussed that for the diagnostic purpose we will basically assess the physical, you can say, assessment is there, then neurological examination, some imaging techniques, and also the alpha-synuclein test, okay. Genetic test is also playing a role. Then we discussed about, you can say, the treatment and management. We discussed the three kind of management. One is called as the pharmacological management, to providing the precursor dopamine drug, that is called as the levodopa. Then we have the amantadine, a kind of antiviral drug which basically have the effect on dopaminergic receptors, so acting as a dopamine agonist. Then we discussed about either we can give certain drug which can enhance the dopamine, or either we can inhibit the, you can say, the acetylcholine. So for acetylcholine inhibitions we have the procyclidine, a drug, okay. Coming to the surgical management, we discussed about the deep brain stimulation. In this, you can say, surgical procedure, we implanting an electrode to the, you can say, diseased area of the brain, okay, and we will put the, you can say, the electric monitor inside the collarbone, okay, and this will, you can say, stimulate the injured neurons or dying neurons. Thereby there is a, you can say, some you can say, relaxation. Got it? No problem. So I hope you understood today's lectures. So thank you for having me. Bye. Have a nice day.